All right, today we are diving into a pretty complex medical puzzle: inflammatory muscle disorders. Think of this as a field guide, the kind doctors use to navigate these tricky conditions. And it all starts with one very common symptom. So let's start with this fundamental question. Someone comes in with muscle weakness. That's a huge, vague problem, right? The human body has over 600 muscles. So where in the world do you even begin to look? How do you narrow it down from, hundreds of possibilities to an actual diagnosis? Well, it turns out the secret isn't just that the muscles are weak, it's all about where they're weak. The specific pattern of the muscles that are affected, that acts like a diagnostic map. It's the clue that points doctors in exactly the right direction. So our first step has got to be learning how to read this map. We're going to dive into the different patterns of muscle involvement and see what they can actually tell us. When you look at the source material, this whole thing really breaks down into 4 key geographic patterns of weakness. And understanding these is the absolute first step in decoding the problem. Okay, let's start with the 2 most fundamental patterns. First, you've got proximal weakness. This hits the muscles closer to your core. Think shoulders and hips. It's the kind of thing that makes it hard to lift your arms over your head or just get up out of a chair. Then, the opposite is distal weakness. This affects the muscles further out, like in your hands and feet, which can make it tough to grip things or even cause you to trip, a thing called foot drop. But as you can probably guess, it's rarely ever that simple. A lot of the time, these patterns get mixed up. Check out this table. It shows 2 really common mixed patterns. You might see weakness in the shoulders, which is proximal, but also in the lower legs, which is distal. Or look at that second row. Weakness in the hands and forearms, distal, but also in the thighs, which is proximal. That very specific combination is a classic clue for conditions like inclusion body myositis. Right, but the map doesn't just end with your arms and legs. The next set of clues, and these are often really specific, can be found in the face and the throat. For instance, if a patient has drooping eyelids, the medical term is ptosis, and some weakness in their eye muscles, that points pretty strongly towards something called a mitochondrial myopathy. Now, if you add difficulty swallowing to that, what doctors call bulbar involvement, the diagnosis might shift towards something like OPMD. It's really like being a detective, You're just piecing all these little specific clues together. So now that we kind of have a handle on the map, the where, we can start to zero in on a specific cause we're looking at today, a group of conditions known as the inflammatory myopathies. And this brings us to a really critical question. All those patterns we just looked at, they can have lots of different causes. But what happens when the root of the problem isn't genetic, it's not external? What if it comes from within? What happens when your body's own defense system turns against itself? Well, this is the technical definition of an inflammatory myopathy. It's when these specific immune cells, called mononuclear cells, mistakenly cause this ongoing inflammation right in the muscles, and that leads directly to that chronic weakness and fatigue. To put it a lot more simply, this is an autoimmune condition. Your immune system just gets confused. It thinks your own healthy muscle fibers are a threat, and it launches an attack. This causes that chronic inflammation, which then leads to all the weakness and fatigue we've been talking about. Now, even inflammatory myopathy is a pretty big umbrella term. So, for the final part of our guide, let's look at how experts classify these specific disorders even further. According to our source material, clinicians have identified 7 major variants of these conditions. And knowing these 7 types is absolutely key for getting an accurate diagnosis and finding an effective treatment. And here they are. We've already mentioned inclusion body myositis with its really unique weakness pattern. But then you also have things like dermatomyositis, which, as that name derma kind of suggests, often comes with a very distinctive skin rash. And then there's immune-mediated necrotizing myopathy, which is a particularly aggressive form. Every single one of these 7 types has its own unique clinical signature. And this right here, this is why this whole classification thing matters so much. This isn't just an academic exercise. It's not about putting things in boxes for the sake of it. It's an essential diagnostic tool. By figuring out which of these 7 categories a patient fits into, doctors can more accurately predict how the disease will progress and, most importantly, choose the therapies that are most likely to actually work. And that leaves us with this one last thought. We've gone from the super broad symptom of weakness down to patterns, to a specific cause, and now to these 7 distinct types. As our understanding gets more and more granular, more detailed, could this be the key?
Could this detailed level of classification be what finally unlocks highly targeted, incredibly effective treatments for each specific variant, and really change the future for people living with these disorders?